Good evening and welcome to the evening session of the Health and Government Operation hearings. I am Vice Chair Bonnie Coulson, substituting momentarily for our chair, Pena Melnick, who will join us when she is able to, because at this point in the session, the meetings just seem to roll into each other. So she's off at another meeting right now. We have a number of bills tonight, and we are going to do the bills that have witnesses first, and then we are going to go to bills that are sponsor only. And those are bills typically that were filed late, and we give them the courtesy of hearing them, but we don't take the long period of time necessarily in a hearing. We are going to start this evening with House Bill 16. That's Delegate Jackson, but I understand Delegate Allen is presenting the bill. And this is state designations, symbol of a remembrance for September 11th, freedom flag. Welcome, Delegate.
Thank you, Madam Chair. Always good to be here. All right, Madam Chair, friends and colleagues on the committee, my District 8 compatriots, my name is Delegate Nick Allen. I'm here to testify today in support of House Bill 16, which was originally filed by then Delegate Jackson and is now cross-filed by Senator Jackson. I'll let my panel, I believe they're here virtually, tell us in a little bit more detail about the history of this flag and why it's important. I also think you guys have heard this bill before, but I want to start by saying that I'm especially proud and humbled to be trusted with this legislation because it is so important and it is so personal to me. Those of us who are old enough to remember where we were on September 11th, 2001 will never forget that day. For me, personally, I was 11 years old in algebra class, but the terrorist attacks also had a distinct and direct effect on the course of my life and my decision to attend the United States Military Academy and later serve in the Army. So less than 11 years after those attacks, I found myself in Afghanistan, again, a direct result of what happened in 2001. In the years and decades since then, we have seen a number of different, equally profound ways of remembering those lives lost and commemorating the heroes who stepped up for their fellow Americans, including the 9/11 Memorial and Museum in New York City, the Flight 93 Memorial in Pennsylvania, and the memorial at the Pentagon, and Maryland's 9/11 Rolling Memorial. I believe designating the freedom flag as the official Maryland state symbol of remembrance for 9/11 would be another important, meaningful way of making sure those lives lost and our American heroes are always remembered. We have memorials in New York, Pennsylvania, and Virginia, and we definitely should. But I also think we need to remember the role that Marylanders and Maryland's first responders played immediately after those attacks. As time goes on, there's great value in making sure Maryland students and young people are also taught about one of the most significant days in American history and in the history of the early 21st century. In fact, I will say in closing that the time is especially right for this bill because we are nearing the 25th anniversary of the September 11th attacks in 2026. So now would be the optimal time to designate the freedom flag as the official state symbol of remembrance. I thank you for your time. I turn it over to my panel, and I look forward to answering any questions you may have, and I urge a favorable report.
For stepping up for the now senator. And I'm going to pull up your other two virtual witnesses, if you can, and then we'll ask questions.
Thank you.
I see that Clarence Singleton is on. Clarence, are you there? Maybe just Clarence's camera is there. Clarence Singleton. Yeah, I'm afraid so. And is Mr. Riley, John Riley, on? Okay. I'm afraid that Mr.
That's quite all right. The hour is late.
Here.
I won't make the committee wait around any longer. But if you have any questions, please feel free to reach out to me or my office.
Well, we're going to see if anyone has any questions now. Are there any questions from the committee now? Delegate Riley.
Thank you, Madam Chair. Real quick, so I had a flag. So on this, I don't see it in the physical note or anything. So is it to fly on a pole or is it to be in a?
Yes, it can be flown on a pole, obviously below the state and federal flags, of course.
Okay.
And the idea is it will be flown during the month of September as a kind of a commemorative educational thing.
Thank you.
Okay. Any other questions? Seeing none, thank you so much, Delegate. And that concludes the hearing on House Bill 16. We will go to House Bill 169, so don't leave your seat. That's Delegate Allen. And it's state designations, State Natural History Museum, Natural History Society of Maryland, and that is Delegate Allen. Please, and your is that all of your panel there?
Yes, ma'am.
Okay, go ahead and get started.
Wonderful. Well, once again, Madam Chair, members of the committee, and my District 8 colleagues, my name is Nick Allen. I'm here today to testify in support of House Bill 169, which would name the Natural History Society of Maryland as the official state natural history museum. This is a reintroduction of last year's bill. And again, I'm here to tell you, and I'm incredibly proud to tell you about a hidden gem in District 8 in Baltimore County in Overley. It's a hidden gem full of history, one that's been around for almost 100 years, and yet almost no one outside of the immediate community knows about it, but now you all do. The Natural History Society. I'll let my friends on the panel tell you a little bit more about their past and the exciting things they have going on right now, but I just want to say how proud I am again to have this incredible place in District 8 and to also be a member of the society myself. Fundamentally, I believe Maryland as a state deserves a Natural History Museum, and the sad fact is we are one of the very few states in the country without one, and I think we really ought to and should change this. We really have three options, and that's right now to continue on without a museum, number two, to start a museum completely from scratch, or three, to adopt the Natural History Society, which is already growing and already thriving, and help it to develop and become even better and the museum we all deserve. So I thank you all for your time and consideration during the busiest week of our session. I want you all to know, regardless of how this bill turns out, that once again, you guys are invited to come visit in the interim. I know the chair and I talked a little bit in the interim about organizing something, and we weren't able to get together, but I'm determined to make it happen this interim, and we'd love to have you all come visit District 8. I turn it over to my panel. I look forward to answering any questions you have.
Hello, my name's Dave Pittenger, and I'm the Vice Chair of the Board of the Natural History Society of Maryland. I want to thank the committee chair and the committee, and of course, Delegate Allen for introducing this bill, and hope that you will look upon it favorably. Maryland is one of the few states, as Delegate Allen says, that has no official natural history museum, and like him, we feel we really need one. We have no state repository for natural history collections, and there is no officially recognized institution entrusted with educating the public about our natural heritage, while also providing the critical role of preserving and coordinating scientific collections. Though Maryland has no officially recognized natural history museum, we do have an organization that has been caring for these collections for almost 100 years, and that organization is the Natural History Society of Maryland. The museum is doing very well. This week we closed the very successful and first time ever temporary exhibit of a woolly mammoth in Maryland. And with previously approved funds from Baltimore County and the state, we were beginning a major renovation of the museum. Over the years, we've cared for our collections, participated in research around the state, and educated Marylanders of all ages. We do all these things museums do, but on a smaller scale. Your support will help us grow into the institution that Marylanders deserve. Thank you.
Thank you. Next, please.
Hello, I'm Rafael Santos, a staff member at the Natural History Society of Maryland, and I'm going to speak about part of the museum most of you know nothing about. A museum consists of two parts. There's an inner museum where collections are housed. Research typically takes place there. And then there's the outer museum, and that's the part of the museum you experience when you visit. The outer museum is where things have already been interpreted for the public. This bill will benefit the inner museum. When research takes place, the collections are studied to answer important questions about medicine, disease, biotechnology, environmental management, conservation and wildlife studies, climate change, agriculture, fisheries, pests, minerals, and recreation and education. The collection contains irreplaceable information. The research to gather this information takes place in the inner museum behind the scenes. The House bill benefits the inner museum and addresses an issue that the state and the Natural History Society of Maryland have been grappling with for 95 years. Because Maryland doesn't have a state-designated repository, collections like this sample, which is from a collection that has 17,000 butterflies in it and was made by one individual, often don't reach us. We were able to obtain this one, but only at the last minute because at the end of life or when people are downsizing, things like personal collections are the first thing that people say, well, we don't know what to do with this. And because we don't have a state-designated repository, these collections often end up in the landfill. The state designation will increase our visibility and will allow collections like these to become part of Maryland's natural heritage. And with the decline of insect populations, this may also help preserve rare species for future conservation and renewal. Those are the benefits of this bill. Thank you.
Thank you. Next, please.
Good evening, to the chair, members, and Mr. Allen. I want to thank you for your time and your service. It was really incredible today to see everything you've done. Okay. My name is Twig George. I'm a trustee of the Natural History Society of Maryland, and I'm speaking in support of House Bill 169. Our museum has collections, but it's also open to the public with programs designed to educate, engage, and enlighten. Operating as a 21st century museum, we hold online as well as in-person classes and field trips. We offer children and the public the unique chance to be shoulder to shoulder with experts that actually do the science and publish the data. These experts come from institutions in Maryland, around the country, and beyond. In 2024, we held 262 programs with 6,500 participants. We are open to the public at least 120 days a year, bringing in an additional 5,000 guests. Admission is free. In a sense, between our programs and our public hours, NHSM is always open. Our programs are linked with the collections in our museums, but occur all over the state, from fossil collecting trips in Calvert County to natural history canoe trips on the Susquehanna. We already collaborate, I would bet, with institutions in your district. With the Maryland DNR, we coordinated a statewide inventory of reptiles and amphibians using citizen scientists and middle grade students from Calvert County Public Schools. The results were published by Johns Hopkins Press, which was pretty cool for the kids. The Natural History Society runs lake and surveys in Frederick County, collaborates with libraries, and provides merit badge training to scouts from across the state. 213 fossil kits have been distributed to Maryland teachers free of charge. These kits can reach an estimated 8,000 K-12 students each year. The Natural History Society of Maryland has provided over 96 years of excellence. Our designation as a Natural History Museum will provide a safe place for Maryland's collections at the risk of otherwise being discarded, allow us to reach more students and teachers, contribute to important research, and continue to collaborate with other institutions. I hope you will support it. Thank you.
Wonderful job. Thank you. Are there questions from the committee? Delegate Hutchinson.
So do you have a special chromite display?
I was going to make a joke about that. We don't have the orange crush, but we do have the chromite on display. So.
There you go. And then if the woolly mammoth exhibit was pretty spectacular too. If unfortunately it's on its way out, but check out some of the photos online. It was really cool.
Thank you.
I want to thank you for bringing this bill back, Delegate, and reminding us of the museum. But also to let you know that HGO committee likes field trips, so perhaps this will be the year that we can get there.
I also do want to mention too, this is another one that's cross-filed by Senator Jackson, and it sounds like I think it's in EEE, so they're pretty enthused about it as well.
Great. Is Marissa Canino here?
She's not here tonight.
She's not here. Okay, great. With that, then, thank you so much. That completes the hearing on HB 169. And we will go to House Bill 690, Delegate Long, and it's Overdose Awareness Day.
Thank you, Madam Chair. I'm substituting for Delegate Long today. Unfortunately,
we're into substituting tonight, yes.
He couldn't be here today, but again, thank you, Madam Chair. My name is Cameron Gross, Legislative Director for Delegate Jeff Long, testifying on his behalf today. Thank you for this opportunity to present House Bill 690, Overdose Awareness Day. Each year, Maryland loses thousands of residents due to drug overdose-related deaths. This legislation seeks to formally recognize August 31st as Overdose Awareness Day, honoring those we've lost while encouraging individuals struggling with substance use to seek treatment and support. By establishing this day, Maryland takes a necessary step in breaking the stigma surrounding addiction. This designation would foster public awareness, and highlight available resources aimed at prevention and recovery. And also, if I may add a common theme today, this bill has no fiscal note. With that, I urge a favorable report on House Bill 690. Thank you so much.
Thank you. I'm going to ask, Teresa, are you going to speak? Why don't you come on up before we ask questions?
Thank you so much, Madam Vice Chair, and good evening, members of the committee. For the record, my name is Teresa Hessler, and I'm here today representing the Recovery Housing and Treatment Centers Coalition of Maryland. We are in strong support of House Bill 690, and we thank the delegate for bringing this bill. This session, you've heard a number of bills addressing addiction and recovery, many of them complex and multifaceted. House Bill 690, however, is pretty straightforward. It's something simple we can do, but it carries a powerful message. By designating August 31st as Overdose Awareness Day, we can take an important step in recognizing those we've lost, supporting those in recovery, and reaffirming Maryland's commitment to fighting addiction and reducing stigma. But awareness alone is not enough. We must also recognize that recovery is a journey, not a single step, and that journey looks different for everyone. It requires the full continuum of care, from detox to inpatient treatment to outpatient programs, recovery housing, and peer support. When these services work together, we meet people where they are and give them the tools they need for long-term success. And we are seeing progress. And I thank that this committee for all the work that you've done. In 2024, Maryland saw a 38% reduction in fatal overdoses, a direct result of comprehensive treatment programs, harm reduction strategies, and community-driven initiatives. And the acknowledgement of Overdose Awareness Day each year will send a strong message to Marylanders. We see you, we support you, and we are here for you. Therefore, we ask the committee for a favorable report on House Bill 690. Thank you so much.
Thank you. Thank you for your endurance and patience. Questions from the committee? Delegate Kerr.
Mr. Gross, at 7 p.m., a train leaves Chicago traveling west at 70 miles per hour. At the same time in Sacramento, a train travels east on the same track at 30 miles an hour. At what time and in what location do they meet? And please adjust for time zones.
I know you warned me about this question in the office, but I'll have to defer, and I'll follow back up with you with an email.
Thank you, thank you. No more questions, Madam Chair.
A student of yours, Delegate?
I share an office with Jeff Long.
Okay.
This is his first time.
Oh.
I was very nervous.
Are there any questions for Mr. Gross?
I'll take all questions. I'll give them by email.
Thank you. Seriously, are there any other questions from the committee? Over here, I heard. Oh, I thought you turned it off. Delegate Taveras.
Thank you. Why August 31st?
So I can answer that. So August 31st is International Overdose Awareness Day. We don't have one nationally, but it would just coincide with International Overdose Awareness Day, which has been deemed for quite some time now as August 31st.
Okay, Delegate? Okay. Thank you very much. Thanks for giving us your time and your testimony tonight. And that concludes the hearing on House Bill 690. We're going to go to Delegate Woods now for House Bill 667, and that's State Government Legal and Employee 667, State Government Legal and Employee Holiday, Maryland Emancipation Day.
I had nothing to do with all of that stuff that was going on with that other House bill number.
That's right.
It wasn't me. Good evening, Madam Chair and esteemed members of this Health and Government Operations Committee, to which I am extremely excited to be a member. For the record, I'm Delegate Jamila Woods, District 26, here to present House Bill 667, State Government Legal and Employee Holiday, Maryland Emancipation Day. Legislation that seeks to establish November 1st as Maryland Emancipation Day, a permanent state legal and employee holiday. This bill is not merely about adding another date to the calendar. It's about acknowledging the reality of our history, honoring the resilience of those who fought for freedom, and reinforcing our commitment to truth, justice, and reconciliation. On November 1st, 1864, Maryland took a decisive step in abolishing slavery with the adoption of a new state constitution nearly 2 years after the Emancipation Proclamation and prior to the ratification of the 13th Amendment. Unlike the Federal Emancipation Proclamation, which applied only to Confederate states, Maryland's decision to end slavery was an intentional and direct action by its citizens. Recognizing this date as an official state holiday ensures that this pivotal moment in our history is preserved. Future generations understand Maryland's distinct path to emancipation. Some may argue the governor's proclamation is sufficient to recognize this occasion. However, proclamations are discretionary and subject to change with each administration. A legally established holiday, in contrast, provides lasting recognition and ensures Maryland Emancipation Day is consistently honored with the respect it deserves. While Juneteenth commemorates the delayed enforcement of emancipation in Texas, Maryland's path to freedom followed a different timeline and a different set of circumstances. Recognizing Maryland Emancipation Day does not diminish the importance of Juneteenth, rather it complements it by ensuring Marylanders acknowledge and reflect on their state's unique history. Just as we observe both President's Day and Maryland Day, we can and should honor both Juneteenth and Maryland Emancipation Day. Establishing Maryland Emancipation Day as a legal holiday presents cultural and economic benefits, creating opportunities for historical education, community engagement, and local celebrations that enrich our collective understanding of Maryland's role in the fight for freedom. Schools, museums, and civic organizations can utilize this day to foster meaningful discussions and initiatives that contribute to public awareness and historical preservation. I urge this committee to issue a favorable report for HB 667. This bill is more than a day of recognition. It's about affirming our history, acknowledging the sacrifices of the elders who came before us, and ensuring their legacy is never forgotten. Let us take this step toward meaningful remembrance and commit to preserving Maryland's journey to justice. With this, I'm asking for a favorable support of House Bill 667. Thank you.
Thank you very much, Delegate. Good information. Are there questions for the sponsor of the bill? Seeing none, that was very thorough. Thank you very much.
Thank you.
And that concludes the hearing on House Bill 667. And we will go to House Bill 668. And this is Delegate Morgan, Victims of Communism Memorial Day. And Ron Elfenbein, is he here?
No, that was a mistake. Ron was never testifying on the bill. Under organization, it was Carolina Litzman, and she was with the National Victims of Communism Memorial. She was here, but unfortunately, she's not here at 7:30, or is it even later than that, 7:45. So she had to go home. I believe there is another
there is
person.
And so
yeah,
we'll bring
Elena
the
Brewer
person up.
is
Okay.
online. So awesome. Delegate Matt Morgan, House Bill 668. What this bill does, it names November 7th of every year as Victims of Communism Day. And how I came about this bill was kind of interesting. I was doing a community event down in St. Mary's. It was a big event. It was like 5,000 people, and I was speaking at it. I was the announcer. And it kind of rained out, and people kind of scattered. And I remember seeing this young girl who was probably 15, 16 years old. Kids were out there, like, kind of playing in the rain, goofing off. And she had on this red shirt with a hammer and a sickle. And it was the Soviet flag. Yeah. And I'm like, I was just kind of shocked. I was like, as a kid that grew up in the 80s during the middle of the Cold War, I'm looking at this young girl wearing this shirt. And I was like, man, I can't believe her parents would let her go out wearing this. This is as offensive to some people as a swastika. And I came home and I told my wife about it, and we were talking about the next day. And she's like, well, they just had this poll up that says millennials, 34% of them, actually support and view communism favorably. And I was like, well, that's crazy. And I talked to my daughter about it, because she just graduated high school a few years ago. She's a sophomore in college. She's like, yeah, we never learned anything about this in school. And it just, I find that shocking, because we're constantly made aware of the race-based genocide that was committed by the Nazis. And somehow we always overlook and almost have forgotten, ever since the Berlin Wall was taken down, of the class-based genocides committed by the Soviet Union and the Communist Party of China and numerous other communist regimes. The Communist Party, or I should say communism itself, they're responsible for about 100 million deaths. And to put that in perspective, we only have 330 million people in our country. So think about that. I just find it hard to believe that this happens and people don't really take a look at the systems that put in place. So started researching this and reaching out to a lot of the immigrants that I knew that have came from Eastern Bloc countries. And I tell you, those are amazing people. And one thing you'll realize quickly with talking to them is just, it's so refreshing to see how much they love this country and how appreciative and how articulate they are about it. So this bill would make November 7th, Victims of Communism Day. We would join 9 other states that have already passed this, including some of our neighbor states like Virginia, Pennsylvania. California's passed this, and South Carolina. And I wish the other sponsor panel was here, because I'm sure she could answer a lot of your questions. But with that, I'd like to turn it over to my friend, Elena Brewer.
Ms. Brewer, go ahead.
Yes, hi, can you hear me?
Yes.
Hi, good evening. My name is Elena Brewer. I am a wife and a mother of 3. I reside in California, Maryland. As a naturalized citizen born and raised in the Republic of Moldova, former USSR, I'm particularly grateful for this opportunity to testify in favor of HB 668 and make my voice heard. The Soviet Union collapsed when I was only 10 years old, yet to this day, more than 3 decades later, my extended family, my native country, my people still suffer the consequences of this atrocious regime that destroyed our cultural identity and our rich Christian heritage. The communist regime erased Moldova's history and destroyed our dreams of prosperity. It took away our freedoms, persecuted all Christians, and sent our people to Siberian labor camps, and indoctrinated generations through Leninist and Stalinist ideologies. In the name of equity, I want everyone to pay attention to this. In the name of equity, generations were doomed to a life of deep poverty, and hundreds of thousands in my native Moldova were massacred. My own family suffered greatly because of the communist regime. My great-grandparents, a land-owning family, lost all their property and barely survived the famine of 1948, an artificial famine created by the Stalinist regime. Until their death, my grandparents rarely spoke of their childhood and were always eerily quiet anytime the subject of Stalin, famine, the Bolsheviks, or war came up. I still remember the pain in their eyes, and I still remember the pain in my father's eyes anytime he spoke of helping raise his 7 siblings in deep poverty during 1960s. These were all lives shattered by the communist regime. Let's honor their memory. So I'm grateful to be able to speak in favor of this bill.
Thank you very, very much for being here and helping us to really understand from your perspective the experience. I really appreciate it. Questions for the sponsor or his panel? Delegate Bandari.
Yeah, thank you for the bill. Given the historical laws such as Smith Act and the Macron Act and the Communist Control Act of 1954, do you believe that communist movement or ideologies still pose a threat to the United States today? If so, what ways do you think they influence society, policy, or political discourse?
So which country? I missed the first part that you said, or you're talking about?
No, I mean some of the laws that we have, like the Smith Act, Communist Control Act of 1954, they're banned completely.
So I'm not familiar with the Smith Act at all, but I can tell you that I do feel the communist ideology is a threat to our country. You see it playing out worldwide even today with how some of the Uyghurs are treated over in China. So people don't really understand, like, on the Republican side, we joke about it. This ideology is very dangerous and threatening. Another witness that we had, She Van Fleet, in her book, and she was supposed to testify as well, in her book, Mao's America, she talked about in 1966, during the Red Revolution in China, they executed 10,000 landlords. Now, 1966 wasn't that long ago. This is a very dangerous ideology. It seems to come up to the same results time and time again. And I think that Americans that have immigrated here and left that behind, they have a lot to offer. And I think the chances are to learning from those victims would be important.
Thank you.
Okay. Thank you, Delegate. Any other questions? Delegate Hill.
Thank you, Madam Chair. Thank you, Delegate Morgan, for the bill. Ms. Brewer, I thank you for taking the time to be with us today. Although Russia is no longer communist, my question for you is, do you see them as a threat now, and what is your view of how the U.S. is currently responding to the Ukraine-Russia situation? It's not communist. Is it similar to you? Do you consider it the same kind of threat, or do you see it as something different?
Well, I'm not sure that would be a good. I mean, the question is about the war. I don't necessarily prefer. I mean, I don't like to answer about the war because there's such polarizing opinions about the war. But the people are suffering. Over 1 million Ukrainians died. Obviously, it's very dangerous. Yes, Russia occupied, but Russia occupied for a reason. I would like for our politicians to be honest why Russia occupied. So, however, back to the conversation of communism, people there in some ways sometimes are freer than we are here in the United States. We have radical gender ideology being pushed on our kids in schools, and parents can't do anything about it. This is communism. When you push something on people in a free country and they keep voting no, they keep saying no, parents fight for it, and our legislators keep doing it. That is a form of communism. This is socialism, when people have no power, when they have no freedom. This is just one. When every single day kids are taught in school that they're racist, that is wrong. This country has freedom. In this country, everyone who works hard has a future. But these are just a few examples. So for us to be divided into groups, the divisive politics are everywhere in the United States. It's in the media everywhere. Why do we have to talk about the race and gender? Why? Why? This is the United States. We all love this country. I came to this country for freedom. I came to this country for a future, for prosperity. I have a family. I'm raising my family here. I love this country. And when was the last time that our politicians talked about loving this country? I grew up with this rhetoric in my home country, when everyone hates everyone and everyone is divided up in groups and so forth and so on. So that's why I'm in favor of this bill, is because we need to be reminded of how dangerous this is. And this country was not built to give equity to anyone. Equality, equal opportunity, not equity. Equity is a Marxist term. It's Marxist terminology, which is so dangerous. And it leads to what communism did, massacre of 100 million people because they were not being equitable. So we really need to ask ourselves what we are doing. And I truly believe the reason I'm supporting, I really want us to understand and have a Memorial Day for this, is because we need to understand that these dangerous ideologies are knocking on the door of the United States. And until we wake up and realize how dangerous this is and how divisive and destructive, and the fact that there is no return. I talked in my testimony about my great-grandparents, my grandparents, my father, my entire family. All of my heritage was destroyed because of this ideology. And I'm just one of millions. But how many countries, how many cultures, how many Christians would be slaughtered for this? And what group is being persecuted the most in the United States right now? Christians. And we are repeating the same thing over and over again. So we need to be reminded once again of why it is important that we understand how dangerous this ideology is. And it is as against of anything that this country stands for and anything that the founders of this country stood for. The founders founded this country on religious liberty, on freedom. This country was built for freedom, and we need freedom. Freedom in every aspect possible. We want our people to flourish. We want them to work hard, and we want everyone to prosper. And communism does exactly opposite. So that is, I'm grateful that you asked me that, and I would like for us to maybe hold a minute of silence for the victims of communism, and maybe think about how we can stop this war in Ukraine, because we need peace. The entire area is shedding blood.
Thank you so much.
Thank you. We appreciate your passion and appreciate, all your perspectives. So thank you very much. I have a question, Delegate. You said November 7th, and you said there are a number of other states that have this.
Yeah, we would be the 10th state, I believe.
And is it always November 7th?
It's always November 7th, and that was the start of the Bolshevik Revolution in Russia.
Connection. Okay, great.
Thank you.
Other questions? Seeing none, thank you very much, Delegate. Thank you, Ms. Brewer. That concludes the hearing on House Bill 668. And I am going to Delegate Kaufman next.
Can Delegate Wims come up so he can help me carry my Bible?
Not only can he come up, he can stay up because he's going to be next. Okay. So good things started on November 7th. Delegate Sample Hughes, are you here for Delegate Bhandari's bill? Or okay, just wanted to make sure I wasn't missing something here. It is, but she wants to watch, I think. And Delegate and Mylash, Dr. K is going to be here too. Yeah, okay. Yeah, they were tired. Yeah. Oh. No, it's me. Thank you for your patience, Delegate Kaufman. But I know you appreciate the history lessons we've been receiving.
Oh, yes. And my friend Delegate Martinez always calls HGO Judiciary Junior, and now I see why.
So let me introduce the bill, Delegate. This is House Bill 1493, Delegate Kaufman. It's Health Occupations Prescriptions for Children Subject to Shared Custody or Visitation Schedules. And this is a sponsor-only hearing. So, Delegate, the floor is yours.
Good afternoon, good evening, Vice Chair Cullison and esteemed colleagues. I'm Delegate Aaron Kaufman, representing District 18 in Montgomery County. I'm requesting a favorable report on HB 1493, prescriptions for children subject to shared custody or visitation schedules. Senator Nick Charles asked me to be his cross-file on this bill. The bill requires healthcare providers to issue 2 prescriptions for each drug prescribed to a child if a parent presents a court-ordered or court-appointed shared custody or visitation schedule. This bill includes safeguards against the issuing of multiple prescriptions and overprescribing. Medication would be divided between the parents of the child proportionally to the amount of time the parent the parent spends with the child. The bill was endorsed by the Maryland Rural Health Health Association in 2024 because there was a Senate-only version back then. Children of parents in shared custody or visitation arrangements often have logistical difficulties managing their medication. The result is missed doses, miscommunication, and can often be a point of conflict. Colleagues, children of divorce have enough challenges. Under current law, medication can be split between parents voluntarily, but that option is often disregarded due to parental disputes. As a result, parents and children need to move their medication every time they move between parents. Creating separate prescriptions for separate households allows parents to handle the logistics of medication separately, removing medication as an issue in divorce. The bill removes unnecessary stress, ensures children will hopefully never have their medication be a point of conflict between their parents. Research shows children of divorce have a significantly increased likelihood of missing doses. Missed doses can have a huge negative impact on children's health and well-being. And I'm about to cite stats, but there's a citation in my testimony. Nearly 60% of the U.S. pediatric population is living with a chronic illness that requires a strict treatment regimen, and deviating from that worsens symptoms and can create prolonged discomfort. The variance is a result of barriers to medication adherence, meaning that taking a medication, splitting medication between parents removes some of these barriers and will improve adherence to prescribed treatments, reducing missed doses, and ensuring better overall health for children. Insurance companies have raised concerns about this bill being difficult to implement and costly. However, a child's health and health care should be at the forefront. The opposition of doctors and pharmacists is rooted, in my view, in the fact that they do not want to take on the additional work that this bill would require. But I believe the best interests of a child takes precedence over the preferences of adults. And I just want to further add something. I've been testifying before this committee as a citizen since 2007, as Delegate Kipke and the chair will remember. And I've never seen insurance companies not oppose new requirements. So why is the simple act of splitting a prescription too difficult for a sophisticated multi-million-dollar corporation? As our chair often says, the sky is not going to fall. This bill provides for the health and safety of children. This issue has been tackled by other state legislatures. I found that out thanks to the legislative librarians in DLS. For example, Kentucky, Indiana, Arizona, and South Dakota all have statutes related to this issue, but not exactly the same. For example, in Kentucky, the parent shall strive to ensure consistency in the child's routine and discipline. If the child has been prescribed a medication or treatment, the primary parent shall provide a sufficient amount of medication, any necessary medical equipment, and appropriate instructions for each visit to the non-custodial parent. Indiana code states if a child is taking prescription medication or under a healthcare directive, the custodial parent shall provide the non-custodial parent with a sufficient amount of medication and instructions whenever the non-custodial parent is exercising parenting time. Medical instructions from a healthcare provider should be followed. Again, colleagues, this bill is needed because it puts children's health first, reduces parental conflict, protects children, and limits efforts by parents, which happens, to use children and medication as pawns in their marital conflict. For those reasons, I strongly urge a favorable report on HB 1493. Thank you for your time. I'm happy to answer any questions.
Thank you very much, Delegate. Are there questions from the committee?
Thank you. It's always a pleasure.
At first I thought this should be an insurance bill, but I was just told that because it relates to the prescriber who has to prescribe the multiple prescriptions, then it goes to health occupations. So it won't
Okay,
be
well,
my subject.
Delegate Rosenberg will have fun with it then.
Thank you very much. I see no, oh, Delegate Alston, you have a question? No? Okay. You don't anymore?
Are you sure?
Thank you, Delegate Bagnall. Sure.
Madam Chair,
Go
thank
ahead.
you. Just for the record, I think this is a very good bill, Delegate Kaufman, and thank you for bringing it. Isn't it true that when parents actually have protective orders against each other, it makes the exchange of medication even more difficult because there are orders in place saying you can't talk to the person under threat of being incarcerated for violating that order?
Yes, absolutely, Delegate.
Thank you.
Okay. I see no other questions. That concludes the hearing on House Bill 1493, and we will go to House Bill 1552.
Madam Chair, if I may, could I help Aaron? And no, the next person can go.
Delegate Pipke's going to help while you go
okay.
ahead, Delegate Wims, but thank you very much for your kindness and
He's my
grace.
seatmate on the floor. Yes.
So this is House Bill 1552, Delegate Wims, and it is a Maryland Commission for Men's Health Reestablishment. Go ahead, Delegate.
We're going to try and...
Thank you. And good evening, Madam Chair and members of the Health and Government Operations Committee. For the record, I am Delegate Greg Wims, here to present House Bill 1552, Maryland Commission for Men's Health Reestablishment. The bill would reestablish the Commission for Men's Health under the Maryland Department of Health. The bill replicates House Bill 681 from the 2006 session, which passed the House unanimously on the third reader. The Commission would be responsible for studying and reporting the significant issues relating to men's health within the state of Maryland. Health and longevity, domestic violence, and suicide as they relate to men are just a few of the issues the Commission would cover. They would also be tasked to create and coordinate public outreach programs to increase awareness and lower the incidence of pressing health issues affecting Maryland men. The last report of the Commission was put out in 2010 as the Commission sunsetted after 4 years in practice. It is important to revisit men's health in the scope of today's society because much has changed within the last 15 years. The Commission would provide expertise on how to combat the greatest threats to men's health here in the state of Maryland. And I do want to give a little personal testimony for this. I was a member of the Rotary Club in my community, and the Suburban Hospital came out because of the study some 15 years ago and asked all the men to simply take the PSA test, which at the time I didn't know what it was. And so when we did that, there are 70-some members of the club, but there were 35 men. And we took the test, and 2 of them found that their number, the PSA number, was higher. I was one of those. And so what I'm saying today and why this bill is so important to me, I'm not sure if I would actually be here today if it wasn't for the fact that there was someone that came out and talked about men's health, and I got the treatment and so forth, and I've been cancer-free now for about 14 years. The other is just last week, I had a group of, you saw the guys in purple, Omega Psi Phi fraternity, sitting in the back, and I had no idea they were shadowing me that day, that one of the men came up to me and said, Delegate Wims, I'm a breast survivor of cancer. And I've heard of men having cancer, but I've never actually met one. And I was telling him about this bill, and unfortunately, it delayed out. He could be here. So I'd say that just to say that these are very important issues, and I would ask for a favorable report from this committee on reestablishing the Men's Commission on Health. So thank you very much. I'm open for questions.
Thank you, Delegate. Thank you for the bill, and thank you for sharing your personal experience. Questions for the sponsor? I'm looking at you, Delegate Taveras. Thank you. Please excuse us. We're getting a little giddy here. Thank you, Delegate Wims. That concludes the hearing on House Bill 1552.
And thank you. Thank you all for being here so late.
And have a great evening. We're going to go to House Bill 1510, that's Delegate Pippy. And this is Medical Records Notice of Destruction Method. Welcome, Delegate Pippy.
Thank you for all being here. Delegate Pippy for the record in support of HB 1510. This is a mere correction from last year. This committee, along with the assistance of Delegate Hill and Delegate Kerr, helped me craft a bill related to medical records destruction, and this only deals with notice. Last year, there was an omission or a mistake, but it was you have to send a certified letter and email. It was supposed to be or. So this is a one-word bill that deletes and inserts or. And the reason for that is that some medical providers don't have both, and it kind of puts them in a predicament. It does have the support of MedChi and others. We ask that you move favorable in this very complex bill.
I expect that's the easiest bill we've ever heard in this committee. Are there any questions for the sponsor? Seeing none, that concludes the hearing. Thank you so much for being here this evening. Concludes the hearing on House Bill 1510. Okay, let's come back together. Is there anyone here representing, is Delegate Wells here? Then I'm not seeing her. You're representing her. So are you presenting her bill? Okay, so then we'll go to House Bill 1502. That's Delegate Wells. And it's AIDS, Baltimore City AIDS Prevention Sterile Needle and Syringe Exchange Pilot Program revisions. And you are?
Jennifer Martin.
Jennifer Martin. Okay, then, and you are representing the delegate tonight?
Yes.
Okay, thank you, Jennifer. Go ahead.
Thank you. Good evening, Madam Vice Chair and members of the committee. My name is Jennifer Martin, and I serve as the Deputy Commissioner for Population Health and Disease Prevention at the Baltimore City Health Department, and I'm presenting on House Bill 1502. This bill amends the statute that established Baltimore City Health Department's Syringe Services Program. At that time, called in the statute, and still to this day in the statute, outlined as the AIDS Prevention, Sterile Needle, and Syringe Exchange Pilot Program. Since 1994, Baltimore City Health Department has operated this highly effective program. In the year the program began, 67% of new HIV infections were among people who use injection drugs. Today, that number is less than 7%. Another success of the program is around the amount of syringe litter that has been prevented. In the past 10 years alone, the program has collected more than 10 million used syringes. After 30 years of successful operation, it's time for a review and update of the statute that established this program. This is a really straightforward and corrective bill that does three things. First, the bill amends the composition of and authority over the program's oversight committee. Currently, state agencies are required to nominate several members. The bill transitions this authority to Baltimore City, giving the city autonomy over its program while also eliminating unnecessary administrative burden. Second, the bill updates outdated language in the statute. Both significant scientific progress related to HIV, as well as our understanding of the importance of language, have evolved significantly in the past 30 years. Some of the terminology in the statute is now understood to be stigmatizing. We want to avoid further stigmatizing already stigmatized communities, which include people who are living with HIV, as well as people who use drugs. Third, the bill removes reference to the program as a pilot because clearly after 30 years, we can say that this is no longer a pilot program. I'm happy to answer any questions about why this bill is important. Also, you will have received our written testimony as well as a letter of support from the Baltimore City delegation, and I respectfully request that you issue a favorable report. Thank you.
Thank you. Thank you very much for coming and testifying and waiting today. Questions for this witness? Okay. I think you did a pretty thorough job, Ms. Martin. Thank you so much. And have a wonderful evening. That concludes the hearing on House Bill 1502. Now we're going back to HGO members. And so Delegate Bagnall, you're up. And that is House Bill 65, Community Health Workers Appreciation Day. Delegate Bagnall and any of your panel that is here is welcome to the table. You have a few staunch members here.
Thank you. Good evening, Madam Chair and members of the Health and Government Operations Committee. For the record, I'm Delegate Heather Bagnall, District 33C, Anne Arundel County, proud to present House Bill 65, Community Health Worker Appreciation Day. This will sound familiar and is in the same posture as it passed our committee and the House unanimously last year. And you have my written testimony, so I'll summarize. House Bill 65 requires the governor to annually proclaim May 8th Community Health Worker Appreciation Day in Maryland. The language of the proclamation is modeled after a similar version adopted in Ohio in 2022. Several other states, including Indiana, Michigan, and New Mexico, have already adopted formal recognitions of the diligent and important work of our CHWs, and the U.S. Department of Health and Human Services declared the last week in August of 2023 National Community Health Worker Awareness Day. As our committee well knows, community health workers are a key part of Maryland's healthcare workforce, and you've heard me say it often, community health workers are the final puzzle piece, the secret sauce. They know the people and the services in their communities. They speak the language of their communities neighborhood by neighborhood, broker trust in the community, and connect their community members with services from preventive screenings and patient education to mental health and recovery services to oral health screenings. So why May 8th? Because May 8th, 2018, the Community Health Worker Act was signed into law in Maryland, establishing the State Community Health Worker Advisory Committee, the certification of community health workers, and the accreditation of community health worker certification training program within the Department of Health. As we continue the essential work to better integrate our community health workers into our care continuum and stabilize this essential part of our healthcare workforce, we also have the opportunity to pass a commemorative day which will continue to raise the profile of these often unsung heroes. This is a bill that raises awareness of community health workers at no cost to the state, recognizing the essential role they play in the care of our communities. For all these reasons, I ask for a favorable report on House Bill 65.
Thank you, Delegate. Who will go next?
I can go. Good evening, and thank you for your time. I appreciate you all being here so late, so I'll be brief. My name is David Reish, and I'm representing the Community Health Workers Empowerment Coalition of Maryland. We strongly support HB 65, which would establish a CHW Appreciation Day. The CHW Empowerment Coalition was founded to engage CHWs in policy advocacy. You can refer to our written testimony for more on the amazing work of community health workers, but the results speak for themselves. For every dollar we spend on this community engaged care, it saves the health system $2.47. And despite this, our CHWs report being undervalued and underpaid. So we thank the General Assembly for your work on establishing certification for CHWs in Maryland, and we're asking for your continued support. If we establish May 8th as Community Health Worker Appreciation Day, it'll help recognize and support our CHWs. CHWs are already recognized this way in over a dozen states, and it's time for Maryland to join them. So we urge the committee to issue a favorable report on HB 65, and thank you for your time.
Thank you. And next, please.
Good evening, Vice Chair Cullison and committee members. My name is Kim Heiner. I am the Director of the Office of Population Health Improvement within the Public Health Services Administration, Maryland Department of Health. I am also the Chair of the State Community Health Worker Advisory Committee. It is my pleasure to speak with you in support of Community Health Worker Appreciation Day, House Bill 65. As the passage of the Community Health Worker Act in 2018 established the Advisory Committee, certification, and accreditation of training programs. And since its passage, the department has certified over 2,000 community health workers, accredited 25 community health worker certification programs, and CHWs have been certified in every Maryland jurisdiction. The proclamation of Community Health Worker Appreciation Day annually on May 8th will recognize the vital contributions of this workforce, increase and improve retention of CHWs, and encourage informative activities in support of Maryland's community health workers. Thank you.
Thank you. Is Alpheus Sase here?
He did not come
Did not come, okay. And virtually Ashley Willard.
Ashley wanted to be here, but she's sick today. But PJC stands in strong support of the bill.
Okay, thank you. All right, then I will ask for questions for the sponsor and her panel. Seeing none, that concludes the hearing on House Bill 65. Thank you very much, Delegate.
Thank you.
And thank you, Kim and David, for your endurance today. Delegate Woods, we're going to you now. Back to you. House Bill 1521. Pardon? Yeah, we'll do them both at the same time. Thanks. So this is House Bill 1521, the State Board of Social Work Examiners, membership and examination requirements.
Thank you, Madam Chair. Good evening, everyone. Again, I am Delegate Jamila Woods, Legislative District 26 in Prince George's County. Glad to be a part of this esteemed Health and Government Operations Committee. I am here to request a favorable response for House Bill 1521, State Board of Social Work Examiners, membership and examination requirements. This legislation is rooted in equity, evidence, and expediency, as it addresses the urgent need to strengthen Maryland's behavioral health workforce. This bill eliminates the examination requirement for bachelor and master level social work licensure for the licensed bachelor social worker and the licensed master social worker, while maintaining all other critical safeguards, including supervised practice, counsel and social work education, which is the CSWE accredited education, and background checks. Let me be clear. This bill does not eliminate licensure. It does not lower the standards of our profession. It simply removes a barrier that, according to years of data, has proven no connection to competent or ethical practice and has caused disproportionate harm to Black, Latinx, older, and multilingual aspiring social workers across the state. In August 2022, the Association of Social Work Boards released data showing that only 45% of Black LMSW test takers passed on their first attempt, compared to 86% of white test takers. If Marylanders had passed at the same rate regardless of race or background between 2011 and 2021, we would have 1,227 more licensed social workers serving our communities today. These are not abstract statistics. They are missed opportunities to connect families with care, schools with counselors, and hospitals with support. The social work profession demands deep compassion, contextual thinking, and cultural humility, none of which are measured by this multiple choice exam. These exams have never been validated to predict practice success, yet the ASWB, the organization behind them, earns over 75% of its $41 million in revenue from exam fees and has not produced the expected psychometric data to defend its product. It acknowledges and quietly removes proven biased questions from the exam bank, sometimes after test takers have already failed because of them, with no mechanism to restore licensure eligibility. Meanwhile, the workforce need is real. Maryland must recruit 32,800 behavioral health professionals by 2028 to meet the demand. The 2024 behavioral health workforce assessment tells us that 70% of recent behavioral health graduates are either unemployed, working outside the field, or have left Maryland entirely within 1 year. A significant share of those may have been held back by a test that does not measure their readiness to serve, but only their capacity to overcome a culturally biased and inequitable hurdle. This bill reflects the findings of the legislatively mandated work group on social work licensure, which voted overwhelmingly in favor of this change. Only the ASWB and State Board of Social Work Examiners opposed. States like Illinois, Rhode Island, and Connecticut have moved forward with similar changes and have not seen a surge in, has seen not only, a surge in licensed professionals, but no increase in disciplinary actions. We must also recognize the safety concern embedded in inaction. When communities are under-resourced in care, the burden shifts to emergency departments, law enforcement, and foster care. That is not a sustainable or just model. House Bill 1521 is not about lowering the bar, but it's about elevating our values and widening the doors of opportunity. It's about building a workforce that looks like Maryland, understands Maryland, and is ready to serve Maryland. And for this reason, I respectfully urge a favorable report for House Bill 1521. Thank you.
Thank you, Delegate. Questions for this, for the sponsor, Delegate Hutchinson.
Thank you, Madam Chair, and thank you, Delegate Woods, for bringing this forward. I remember talking about this a lot with you last year, but this is the first year you brought the bill forward, or was this the second year for
this is the first bill I've brought the bill forward, sir.
Okay, so my question actually is, though, I was actually interested at an event about 2 weeks ago, and a licensed social worker came up to me, not favorable about this bill, and said that this would affect somebody being able to join the compact that we passed, the social work compact. Is there any truth to that? That would affect that at all?
So bear in mind, there are still, as I articulated, there are still expectations that are put in place. So there are still professional criteria that they must meet to be able to participate as a licensed social worker.
So without the exam, they would still be able to join the compact?
Because there are other alternatives to the exam, yes, sir.
Got it. Thank you so much. Thank you, Madam Chair.
My pleasure.
I would offer, Delegate, that those who want to participate in the compact, and the work group did talk about this, it was probably in their best interest to take the test, but they would be able to practice in Maryland without it under this bill. But the test, nothing will stop anyone from taking the test. Correct. They will still have it available to them, but they wouldn't need it to be licensed, as the delegate so eloquently explained. Yeah.
My pleasure.
Other questions? I have a question, delegates. Did the work group contemplate these alternative standards and how that pathway might move forward?
You know what? I cannot answer that for you in this moment, but I'm happy to get that answer back to you because we've gone back and forth with a lot of things.
I actually want to thank you very much for taking this bill on. I know that it's a labor of love, but it is a labor. This is not an easy bill right here.
Thank you.
So, is that Delegate Gazzoni? Okay.
I feel like having a third person down here at the end has thrown off everybody's ability to see.
It's
okay. It's just like
figure out where the mics are.
Kim can't, and then we can't see anything with the lights. No, it's not you. I was looking at the letter from the board.
I'm sorry.
I was looking at the letter from the Board of Licensure, and they have a variety of things in there, and they're sort of not really like thrilled about this idea. But my question is actually in regards to some of the things that they're suggesting as amendments and whether we might want to include those, the changes they're talking about, that you can take the exam again at after a shorter period of time than what currently you have to wait, in regards to folks that may sort of get licensure but want to be able to do the exam also for the compact purposes. So I'm just kind of curious about that now.
So sure, the answer to that is people can already take the exam again. So that's not something,
Sure.
The shorter period of time, I can't speak for Maryland. I know that in the District of Columbia, you have to wait at least 30 days, I believe it is now, they've changed it to. I'm not sure, and I apologize for Maryland's expectation, but I want to make it very clear that at this state, anyone can take that exam again.
Sure.
And so, you know, if they don't need legislation to reduce the time period that can be taken. The board could do that.
Got it. Thank you.
My pleasure.
Okay. Seeing no other questions, I believe there'll be some additional work on this, Delegate.
That is correct.
Okay.
It's been a lot of work
Thank you very much for
back and
taking it
forth.
on, and that concludes the hearing for House Bill 1521. Don't go anywhere, because you're there for 1538, Delegate Woods. Maryland Medical Assistance Program, Maternal Health Monitoring Pilot Program.
Good evening again, Madam Chair, members of this esteemed Health and Government Operation Committee. For the record, I'm Delegate Jamila Woods, Legislative District 26 in Prince George's County, and I am here to respectfully request a favorable vote for House Bill 1538, the Maryland Medical Assistance Program Maternal Health Monitoring Pilot Program. As you know, maternal health has been a major priority in the state of Maryland, and this bill establishes a pilot program within the Maryland Department of Health to improve maternal and neonatal outcomes for high-risk pregnant and postpartum patients enrolled in the Maryland Medical Assistance Program. By utilizing remote patient monitoring technology, this program provides real-time monitoring of critical health indicators, which include blood pressure, weight, and blood glucose levels, allowing healthcare providers to proactively manage conditions like maternal hypertension and diabetes. These conditions are leading contributors to pregnancy complications, and without proper intervention can have devastating consequences for both mothers and the infants. As a mother and someone who lives with diabetes, I understand firsthand the challenges of managing maternal health while dealing with a chronic condition. And in my case, my diabetes was gestational. When I was diagnosed with diabetes early in my pregnancy, the experience was overwhelming, and I faced many obstacles in accessing the care I needed. Many women, particularly those in low-income and underserved communities, struggle with similar barriers, including transportation, difficulty taking off from work, and limited access to primary care providers. This bill directly addresses these challenges by ensuring that high-risk mothers receive continuous, proactive care, reducing preventable complications, and ultimately saving lives. The maternal health crisis disproportionately affects women of color. Black women in Maryland experience maternal mortality rates 4 times higher than their white counterparts. Systematic inequities, implicit bias in healthcare, and a lack of access to comprehensive maternal care all contribute to this unacceptable disparity. House Bill 1538 is a necessary and targeted response to this crisis, aligning with our governor's commitment to leave no one behind. This legislation builds on my previous work in expanding fetal monitoring protections and reinforces our collective responsibility to ensure that no mother is left to navigate a high-risk pregnancy alone. By implementing proactive preventative service protocols, we can alleviate barriers to care, reduce maternal and neonatal complications, and improve outcomes for Maryland's most vulnerable mothers and infants. And for these reasons, I urge this committee to support and pass House Bill 1538. Thank you so much.
Thank you, Delegate, and thank you for your passion around this issue. I'm looking around for questions. I don't see any questions. I will unfortunately raise the issue of the fiscal note. While it's a very laudable concept and, we would fully support it, I suspect, but given our current budget situation, it would be tough to do.
Probably at this time, you're absolutely correct.
Don't give up.
Thank you.
You'll learn as you are here longer, Delegate, that good bills sometimes take some time. So
I received that, and so I promise you I'm not married to them.
Okay, thank you.
My pleasure.
Seeing no other questions, that concludes the hearing on House Bill 1538. And we're going to go to Delegate Martinez, House Bill 1489. This is Maryland Medical Assistance Program coverage for the treatment of obesity.
All right. Well, good evening, Madam Chair and members of the committee. I am, for the record, Delegate Ashanti Martinez, here to present House Bill 1489, Maryland Medical Assistance Program coverage for the treatment of obesity. I, too, am single and not married to this bill. This critical legislation ensures that individuals suffering from obesity have access to comprehensive treatment under Maryland's Medicaid program. At its core, this bill addresses a fundamental issue of fairness and public health. Obesity is a recognized chronic disease that significantly increases the risk of life-threatening conditions such as diabetes, heart disease, and hypertension. Despite the overwhelming evidence supporting early intervention, Maryland does not currently provide a wide range of comprehensive coverage for obesity treatment. House Bill 1489 seeks to correct this oversight by guaranteeing access to intensive behavioral therapy, bariatric surgery, and FDA-approved anti-obesity medications. Failing to address obesity in its early stages places a heavy burden on both patients and the healthcare system. Studies show that effective obesity treatment can reduce the incidence of diabetes by nearly 60% and lower cardiovascular-related deaths by 20%. For me, this is personal. Over the fall, I was diagnosed as pre-diabetic, which is why I came to session a little bit smaller than I was last session. And the purpose of that is not simply vanity, it is a lot of health. I've lost 2 uncles back to back, year to year, because of heart attacks. They died at work, and I don't want to do that. So, without proper access to care, many Marylanders are forced to delay treatment until they develop severe or mostly costly complications. By expanding coverage, we can improve patient outcomes while also reducing the long-term financial strain of the state's healthcare resources. I also want to note that I'm accepting a proposed amendment to this bill that aligns it with the Senate bill that just provides it provides the Medicaid with flexibility and coverage criteria. The bill originally required Medicaid's coverage criteria for anti-obesity medication to be no more restrictive than the FDA's. This provision has been removed, allowing Medicaid to establish appropriate utilization criteria while maintaining access to necessary treatments. And the second one, it accelerates the implementation timeline. This bill initially required coverage to begin July 1, 2026. The amendment moves the date up to January 1, 2026, ensuring that Marylanders receive access to these essential treatments 6 months earlier. This legislation has garnered strong support from key stakeholders, such as the American Diabetes Association, the Maryland Academy of Nutrition and Dietetics, and the Maryland Nurses Association. Their advocacy underscores the importance of ensuring that individuals struggling with obesity receive timely and effective treatment. By passing House Bill 1489, Maryland can take a proactive approach to reducing the prevalence of obesity-related illness, improving public health, and alleviating the financial burden on the healthcare system. Before I ask for a favorable report again, I know there was a similar bill. Our colleague Delegate Miller had a bill. The differences of the bill is that this was for much more comprehensive coverage that included intensive behavioral therapy, bariatric surgery, as well as the FDA-approved anti-obesity medications. And so with all of that said, I respectfully urge a favorable report from the committee.
Okay, thank you very much, Delegate. Questions from the committee? Okay, so the question I have is the amendments that you made, did they make any change in the fiscal note?
That is the attempt. I haven't gotten a updated fiscal note, but I will try to provide that as soon as godly possible.
Okay, thank you. I appreciate that. Seeing no other questions, that completes the hearing on House Bill 1489. Thank you very much, Delegate. And we are going to go to House Bill 1515, and that's Delegate Cullison. So I am here. And Tracy, if you want to come up to the table just in case there are questions. So Bonnie Cullison here to present House Bill 1515, Certificate of Need Intermediate Care Facilities Exemptions. So we have a set of facilities in Maryland that are called intermediate care facilities, and they are the ones that are substance use disorder treatment facilities. They offer the American Society of Addiction Medicine levels of services and a level of services just below hospital level addiction care. So we need this bill because these facilities up until now have been able to get a certificate of need initially and then be able to grow without asking for any further monitoring. And the reason that's a problem is because sometimes, you know, they were given the certificate for a certain population, and when the population grew, it just meant that there were more people in the individual rooms. That's an example of why we need this. The one example was in 2017, an applicant obtained the CON to establish a 21-bed facility. Within 1 year of opening, the facility provided notice to the Maryland Healthcare Commission of its plan to add 81 beds, which would create a facility that had almost 5 times as many beds as were approved. This makes their review of MHCC meaningless ultimately. And so there wasn't the, and because they didn't need any further review or approval, there were more people in a smaller space with as many as 5 to 6 people in one room. So what this bill does is it replaces the CON requirement to establish or relocate one of these facilities with the same exemption approval process, creating a consistent and equitable regulatory framework for the establishment or expansion of these facilities. It will create a single, consistent regulatory framework, and I want to be clear about the CON exemption process. It does not mean that there's no review. It still requires an applicant to address all the state health plan standards, including need, quality, price transparency. It must also prove that the project will result in more efficient and effective delivery of healthcare services, and MHCC would still review the plans for the physical space and staffing levels to assure that the applicant will provide adequate care for its patients and remain financially viable. The primary difference between the exemption process, which is what we would be using under this bill, and the full CON review is that interested parties are not allowed to participate in the review, and there's a faster time frame for the review. So MHCC and the stakeholders support the changes to the process, and because it benefits the establishment of new facilities by ensuring a faster review process while requiring compliance with standards and provides necessary oversight of the expansion of existing facilities to ensure the quality and safe care is provided to patients. And we have Tracy DeShields here to answer any specific questions about this change in process. So with that, I would ask for a favorable report for House Bill 1515. Are there questions from the committee? Delegate Alston.
Thank you. So last year we had Delegate Grammer's bill to get rid of the certificate of need process for behavioral health. And we worked on it over the summer, and I'm just wondering how this will compare, because he raised a lot of valid points about how the certificate of need is delaying our ability to get good behavioral health in our community, and this is a part of the behavioral health continuum. So can you address that? I mean, I would be happy to do away with all the certificate of needs, but.
I'm going to ask Tracy to address that.
Sure.
Thank you. Sure. Happy to address that. I think Delegate Grammer's bill is different than this bill, and it was to eliminate certificate of need for psych facilities. This is not really doing that. It's providing an exemption. They still have to submit a CON application. There's still the guardrails in place, except what they're doing is asking for an exemption to the full certificate of need review. And then we review it, and if that's approved as an exemption, they can then move forward. But then it also allows us to provide, to say we approve it, we disapprove it, or we approve with conditions. And so now, currently, with regard to bed capacity, they can do whatever they want. And so it's sort of a shell game, if you will. You come in, you get a certificate of need, you get it approved for like a 25-bed facility. And then all of a sudden, the next month, and we actually had this happen where an applicant said in their email to us that they were then going to increase their beds to an additional 75. So, you know, the approval process is important. The review process is important, especially for these particular facilities. And the stakeholders support because the guardrails are still in place for them and there's still the review. 3.7 is a very high level of medically managed drug treatment. And so you do want to have that. You don't want people in a room with 6 other people who are, you know, experiencing detoxification. And I have Maura Lawson here, who's our program manager, and she actually does most of the reviews for the ICFs. So if there's any questions pertaining to that, Maura can also address that. But what Delegate Grammer's bill was doing is something different than what this bill is doing.
Right.
Let it go.
We can work on it
Okay.
in subcommittee.
Thank you.
Delegate Hill.
Thank you, Madam Chair, and I don't have the privilege of being on the subcommittee. I'm sorry, and maybe that it's late and we can take it offline, but I'm a little confused about what you mean by you still get a CON, but there's an exemption or from it. I don't know how you're going to have both. And I'm also, the second part is I'm sure this is all fine, but I was just speaking with someone earlier today who's very concerned about the programs we had where we had the expose in Baltimore where people who were, you know, supposedly getting drug rehab treatment were being housed, getting no treatment, but the people were getting paid. And so I'm not clear if there's a nexus or not, but yeah.
Thanks for your question. The exemption is a process. It's not exempting them from a review. It's exempting them from the full CON review, the full certificate of need review. So it's just a different process. It takes out the, first of all, it shortens the process, and it takes out the possibility of interested parties coming and arguing against the project itself. So exemption is still, they have to get an approval. It's just a shorter approval.
So they're not exempt from a CON?
They are, it's called an exemption from a CON, but they still have to meet all the state health plan standards. We still do virtually, it's a very, very similar review. A couple of the criteria are not now in that exemption review, but they're just similar processes. And I think that the word exemption from CON is a little bit misleading because it's still a very rigorous review of the process. That was number one. And the second point that you made about the news that's been going on, that is in lower levels of care facilities that we don't look at. But one of the important things why we do these reviews to begin with is that we're trying to weed out the fact that we have bad actors. We're able to go in, we're able to look at the physical spaces, we're able to look at the staffing, we're able to look at the policies and procedures that they're putting into place before we are giving them approval to open up. So after that, it goes to BHA to monitor them. But our process, we'll look at all those things to help to ensure that we're not having bad actors coming into this space.
I'd be happy to have a conversation offline. I trust the vice chair, but I'm totally confused. Thank you.
Okay. Okay. Thank you, Delegate Hill. Seeing no further questions, thank you all both for staying here. I appreciate that.
Thank you.
That concludes the hearing on House Bill 1515. And we'll go to House Bill 1499, Delegate Johnson. And Delegate Johnson the bill is State Procurement, Construction, and Services Contract Modification.
Okay, it's late, so we'll get right to it. Good evening, Madam Chair, members of the HGO Committee. For the record, I'm Delegate Steve Johnson, here to present House Bill 1499, State Procurement, Construction, and Service Contract Modifications. This bill calls for the addition of new clauses requiring contract modifications for both construction contracts and service contracts. The clauses would require the equitable allocation for compensation and benefits as it relates to statutory changes or collective bargainings. HB 1499 addresses critical oversights in our legislation for current procurement contracts. With this bill, workers are given the ability to renegotiate unfair terms. It's our duty as elected officials to ensure they are being justly compensated for their work and have legal leverage to demand fair compensation. This bill also encourages transparency in state procurement and will lead to more balanced contracts between the state and its contractors and attract more contractors to do business with the state. The projects that we undertake in this state depend on stability. There are some amendments, which you guys should have, that align this bill with its cross-file, SB 403. These modifications state the contract should be for 3 years or more, for $1 million or more, be approved by the Board of Public Works, and to go into effect October 2026. Look, when these contractors, when they bid these projects, they have no crystal ball. They have to predict what's going to happen over multiple years. So there you have them building in extra costs into the bid to try to offset anything that may happen. So this would be a more stable way that they knew they could come back if something did happen, like we pass laws that change the parameters of those bids or those contracts, or if they go through a collective bargaining situation where it would change possibly benefits or pay. With proof, come back to the state and say, this was unforeseen, we would like to negotiate an adjustment. As you know, contracts have to be fair for the state, but they also has to be fair for the contractors. These contractors rely a lot on subcontractors. A lot of them, they don't have deep pockets. A lot of them are minority businesses, small businesses, women-owned businesses. Any major change in a contract for them means that they either fold or walk off the job because they just cannot afford it without being able to get that compensation another way. Now, we've already done this on the material side of the contracts. If there's some unforeseen spike in materials, with proof, they can come back and they can get negotiated compensation for those spikes. And now we're addressing the labor side because we did not do that when we worked out the material side. And for all those reasons, I would urge a favorable report on House Bill 1499.
Thank you. Thank you for being with us. And everyone, thank you for waiting so late. I was in a meeting, actually 2 meetings. Delegate Hill. Thank you. Thank you, Delegate Johnson. I like the bill, but I'm just curious that it talks about being able to make an adjustment for increased costs as opposed to changing costs. And it may be rare that costs would go down, but is there a reason why we're only talking about being able to make adjustments if the costs go up, but we're not talking about making adjustments if the costs go down?
Well, when they bid the contract, they've already agreed on a price. So really, the only thing that would change is if we made a statutory change, a new law that would increase a price, or if collective bargaining increased a price. They've already looked at everything
I understand that.
and bid on the minimum, what they feel will be the minimum.
Okay.
So
I'm just saying, you're assuming there's no possibility that we would do collective bargaining and the price would go down, or that we're not doing we're not having a change because inflation goes down and suddenly the cost goes down or something. And that's just a presumption, or that's okay. That's why
no, it doesn't. However, I would foresee the bids going down because they wouldn't have to pad the bid, so to speak, with a prediction of something that may or may not happen. They would be able to bid accurately, and then if something did happen, come back for an adjustment.
Thank you.
Any other questions? Real quick, thank you for bringing this. I think a real world example right now is obviously there's a bill being heard right now, business tax. And I've already heard from several big contractors that do a lot of business with the state of Maryland. And they're very concerned because they bid these contracts, and their contracts, they do highway, they're 5 years out. They have no ability to make an adjustment right now. So if your bill were to pass, I think it might give them a little bit of a relief, because now all of a sudden that business-to-business tax is a huge burden on them because their margins are set, like you said. You understand how they do the contracts. And so I think that's probably more apropos than assuming that a collective bargaining agreement might go down. I think that this is more real world because it's there right now. So would you think that that would apply to your bill?
That's something they would have to bring back to the state. If it's something we passed that raised the cost and increased the price of doing that particular job that they had already bid, they would have to come back and, and negotiate that with the state and then go to the Board of Public Works to see if they could get that through.
Right. Thank you, Madam Chair.
Thank you. Taveras. Thank you, Madam Chair. Hold on. Okay. So with the purple line, there was a increase from 4 to 10 million, $4 to $10 billion. In that situation, you could say that it wasn't either of these two cases. It could be the lawsuit and/or just bad negotiation or a mix-up on our part that we messed up in some of the work that we needed to do. How do we compensate under those conditions given the criteria that you highlighted here?
Well, I'm not sure that the state's going to go back and renegotiate if someone put in a bad bid or they did a poor job bidding the job. This is for mandates that we put in place after they've signed a contract that raise the cost of doing that job. I'm not sure. Does that answer your question?
No, we could talk about it later. All right, thank you.
Okay.
Do you want to follow up? No, I don't.
Okay, all right.
This is
Any
the
other
time
questions?
to ask.
Olsted, are you, Delegate Olsted, you're answering for her? Okay, that's it. All right, there's no further question, Delegate. Thank you for being with us today.
Thank you, Madam Chair and Committee.
Thank you. We're going to call House Bill 1544. Actually, you know what? I'm going to skip that one for now. Let me call 1555, okay? Delegate Bandari, funeral establishment, crematories, and reduction facilities oversight, ensuring dignity and accountability in crematory and funeral home operations act. Okay.
Madam Chair, Madam Vice Chair, and wonderful committee members. For record, Delegate Bandari, I'm here presenting House Bill 1555, ensuring dignity, accountability in Crematory and Funeral Home Operation Act. When families lose someone, they rely on funeral homes and crematory for closure. They expect respect for their loved ones, but that trust been shattered. Investigation uncovered bodies left to decompose, remains mishandled, and families questioning if the assets they hold are even theirs. That is not just a failure, it is a betrayal. Right here in our state, on February 14, during our committee briefing, we heard these stories. The silence in this room was impossible to miss. It was not hard to read. It was heavy, thick with pain. I looked out at the audience here behind me. Their faces still, and it was tough to meet their eyes. Were they the families? I don't know for sure. But the weight of their silence said enough. Silence has power. And this bill was born out of that silence. I've seen so much during my 7 years serving with all of you on these wonderful committees. Families cry, share their stories, and look to us for answers. This is where people come to be heard. get real, and find hope. We have built something here. Truth, trust, a place where our state constituents know they can turn. I started drafting House Bill 1555 right then, mid-hearing, because these families can't wait. That night, after the briefing, like so many of you, I couldn't sleep. The filing deadline had passed, but we pushed it through the Rules Committee to get it here today. This demand action now. This bill is very straightforward and necessary. Unannounced inspection to catch violation early, a public database so families can check a funeral home's record before choosing, and strong penalties, fines up to $50,000, license revocation, and criminal charges for repeat offenders are used to hold bad actors accountable. This is not about punishing the industry. Funeral homes that do right by families have nothing to fear. It is about stopping those who exploit trust and hurt people when they are most vulnerable. Some say it is too harsh. I ask, is this too harsh to demand dignity for the deceased? To give families certainty instead of doubt? I don't think so. We have worked with industry leaders, the Maryland Department of Health, and community voices to make this practical and fair. We support MDH amendment to strengthen oversight while keeping it balanced. Because of late filing, so many stakeholders, they could not testify here, but we have their written testimony, and I'm thankful for it. And we are open to amendment, any changes that make this bill better, as long as they honor its purpose, protecting families, ensuring accountability, and restoring trust. I want to thank our wonderful chair, Penia Melnick, for her leadership. She brought us together, reviewed recommendation, and strengthened the bill. At Governor Westmore's request, Charles Schiller conducted a comprehensive operational review of the Board of Morticians and Funeral Directors. His work resulted in 18 key recommendations, including 4 urgent measures to enhance staffing, oversight, enforcement, and authority. We have worked closely with him. If you're watching, thank you very much for doing everything you did, and sincerely appreciate his dedication and expertise. His contributions have been invaluable in strengthening regulatory oversight and ensuring the board operates effectively. And thank you, Delegate Saliga, Delegate Hutchinson, Delegate Samplius, and everybody. This bill is more significant than regulations. It is about justice for those who have suffered, accountability for those we entrust with our loved ones, and keeping the hope alive that families bring to this committee. We can't undo what happened, but we can make sure it stops here. I also thank the media for exposing these wrongs and elevating families' voices. And we are committed to this. Maryland families deserve better, and they are counting on us. I ask a favorable report on this bill. And Madam Chair, we have heard 347 bill this session. And this is the last bill. Erin, Lindsay, and Lisa, thank you for your work.
It's not the last bill, you have another one.
Oh, this is the second last one.
But nice try, though. Wow. Nice try. Are you withdrawing that other one? No, just kidding.
You switched that, yeah.
It's okay.
Thank you.
We do have Nilesh. Thank you for your testimony. We have Dr. K from the department. Can you be so kind and bring him up, please? And then while he... Oh, Nilesh, I gave him permission. The department, they want to. Go ahead, if you can unmute yourself. Yes, go ahead.
Hi there.
Great.
Good evening, Chair Pena-Melnick, members of the committee. You have done yeoman's work tonight. For the record, I'm Dr. Nilesh Kalyanaram, the Deputy Secretary for Public Health at the Maryland Department of Health. I want to thank you for giving me some time just to talk about House Bill 1555, and I want to thank Delegate Bandari as well. This bill would require the State Board of Morticians and Funeral Directors to update certain regulations and also to have to be supported by the Maryland Department of Health. While Maryland's health occupation boards typically function with a high degree of autonomy, there are instances where increased support is required, such as in 2023 when the State Board of Nursing had operational reforms that were needed and necessary, and the Department helped provide those operational supports. We do have extensive institutional knowledge on how to maintain facility standards, manage inspection protocols, and in light of the recent concerns with the Board of Morticians and Funeral Directors, the department is ready and able to provide that oversight at this time. Our one recommendation is to include the authority to sunset after 3 years, and hopefully at that time we can reassess the need for continued support from the department. And so with that, I thank you for your time and respectfully ask the committee to return a favorable report on this bill. So thank you. I'm happy to answer any questions.
Thank you very much. And I know there are a lot of who here, I know you're watching it and you can testify, but if you can get up if you are on this bill as well, go ahead and get up and, okay. Tell us your name.
Ruth Iannardi, the previous Executive Director of the Maryland Board of Morticians and Funeral Directors. Okay. I retired in 2018, and your passion is my passion. I worked very hard with Delegate Pena-Melnick to strengthen the board at that time. I encourage you to look at our sunset from that time.
Thank you so much.
Positive, and this is very disturbing. Thank you all for your work.
Thank you very much. Your name?
Walter Nathan Malloy Jr. On behalf of the Maryland State Funeral Directors Association, we recommend a favorable report with amendments, and it looks like some amendments have been made. I've had a chance to review.
Thank you.
Thank you.
We wanted to give you the respect, although it was a sponsor only, and one of my colleagues texted me and said, I should do it because you've been here all night. I'm not going to take the credit, Delegate Alston, and it was the right thing to do, okay? Thank you for being here. We and all of you that are waiting for the next bill as well. I'm going to open it up for questions, and I see first Delegate Hill. Thank you, Madam Chair, and thank you, Delegate Bandari. I wanted to ask Dr. Kay a question. I'm looking at regulations from 2014, which seem to be the most recent ones, and I see all kinds of stuff about commingling of remains and keeping it clean and wearing gloves. I don't see anything about a refrigerator. I see, am I wrong? This bill really speaks to there have to be regulations about having adequate refrigeration. And I couldn't believe that wasn't in the regulations, but I'm not finding it. Am I wrong? Are there refrigeration requirements?
I think that's, Delegate Hill, I think that's one of those things that we're going to have to look into as to what additional changes, if any, are needed and address those. So, candidly, I'm just getting up to speed on all of the regulations and details, but that's part of what I will be taking a look at over the coming months.
All right, thank you.
This is the latest one I just got.
Yeah. And we're looking through the amendment because we think that refrigeration is in there in the amendments. It's struck, it's in the bill, it's struck?
In the latest version.
Okay. Well, the bill is going to go to subcommittee. So, we'll read it more carefully. And if something needs to be put in, then bring it up. Okay? Yeah. Any other questions? Delegate Shalega.
Thank you. I asked the same question as Delegate Hill before we got the reprint of the reprint of the reprint. And I understand, is that right? That there are regulations. We can deal with it in subcommittee, but I did ask that. I'm like, how can there not be refrigeration requirements? But
excuse me, sir. Are you aware? Do you have the answer?
Do you go by
Can you
Nathan
come up just for questions and answers, like Delegate Collison did? Delegate Olston, I'm learning.
I asked you specifically
Go
about
ahead.
refrigeration.
Give us your name again, just for questions.
For the record, this is my delegate.
Okay.
Yes, there are refrigeration regulations. It's a Comar 09, indulgence 09, 34.08.05 for crematories regulated by OCO. And it's Comar 1029-1905, I believe, for crematories regulated by the Board of Morticians.
Okay, thank you. So glad you're here.
Yeah.
All right.
My pleasure.
And
Hold on, you can stay seated.
Yeah, I just wanted to thank him. He's, answered some of my questions, but I mostly just wanted to say, isn't it so? I wanted to thank you, Chair, for your dedication to fixing this, and I'm sure Delegate Sample Hughes and Bandari and, the others, Delegate Hutchinson, that have worked so hard to fix this.
And yourself, you all came together, so thank you
all.
very much.
We're gonna fix it.
We are. Delegate Bagnall.
Madam Chair, and I'm just wondering, given, to make sure that the transition is clear, do we feel this needs to be an emergency bill, or is October 1st a reasonable implementation date?
We can make it an emergency. Does the committee want to make it an emergency bill? Let's do it. Okay, all right. So, Lindsay, we're just all tired, but I love it. Dr. K, your hand is up. Do you want to be asked a question? What's on your mind?
If I may, I think the department would prefer an emergency bill so that we can get to working right away.
Great suggestion. Thank you. Thank you so much. You have Delegate Sample Hughes and then Alston.
Okay. Thank you, Madam Chair. Thank you for me coming back to the old committee, and good to see everyone. I wanted to expound upon a little bit more of the refrigeration. I think what we need to highlight is, in fact, that there are regulations around refrigeration, but the way the bill is written, the last version that I had to be able to dissect it, was that it appears like every facility has to have refrigeration, meaning a funeral establishment, which is not the case. And is that correct? Mr. Malloy, I'm sorry.
Well,
has to have a contract.
That's
with
correct. The statute currently says if a body cannot be embalmed within 48 hours, it must be refrigerated. And if you do not have refrigeration, you must have arrangements already made with another facility that does provide refrigeration. So at existing, you do not have to have refrigeration unless you're not able to embalm a body within 48 hours. After that point, you must secure refrigeration. So that is already in 5-513 of the Health General article. And one of the issues we raised was the ambiguity of the requirement, what maintaining adequate refrigeration means in light of the already existing statutes that talk about refrigeration. And we were unclear whether it meant every facility. And if I may, and I know I'm not supposed to do this, but there has to be some clarity on what is the difference between a deficiency resulting from an inspection versus a violation. Violation only appears once in the regs, and it's in the penalty section, but it's not clear because of deficiency. You're allowed 30 days to correct the deficiency after an inspection. And our question is, does it then become a violation if you fail to cure the deficiency, or a deficiency and violation synonymous under the current regulations?
And one more question, Madam Chair. So to the bill sponsor, you had referenced, and thank you for your passion, because you almost need to be in the industry as well. But you had mentioned about the consumer and the family members. Would you have an issue with the bill if we were to require the funeral establishment to allow to make the family members, aware of what crematory facility that they may be utilizing if they choose to cremate their loved one?
Could you repeat that question?
Sure. So unfortunately, we're here today because of a crematory situation. For transparency, I was asking, would you be okay with specifically allowing a funeral home to disclose to the family what crematory facility that they'll be going to or utilizing?
Definitely, I mean, this bill, as I mentioned, is not against those great funeral directors and funeral establishment who are doing great job with the character, commitment, and confidence. As long as it is not defeating a purpose of this bill, I'm okay, and I will leave it to the subcommittees.
Okay, thank you.
So just to, if I may, to ask a question further, so if they don't have refrigeration and the body is not able to be refrigerated within 48 hours, they must send it somewhere else. So the question is it okay for the families to know where the body is being sent, right?
If I may, the statute requires that you inform the family.
In what section?
5-513 of the Health General Article.
And when is the family informed?
At the time the 48 hours expires, practically.
Yes, but not your
But
crematory, not if you're going to cremate someone, correct?
But for crematories, 1 second, for crematories, is the same for crematories? That's for funeral, but for crematories?
5-513 applies to crematories as well.
All right. Delegate Chisholm, do you have a question?
No, I think I understood Cherie's question, and I wanted to make sure that.
I didn't, yeah. I wanted, because he didn't answer it. I understood her, but I don't know that he got it.
Perfect, thank you. I
Yeah.
just wanted to make sure everybody's clear.
Yeah. That's why she's here, because she knows it.
And then for the department.
So go ahead.
Sure.
Dr. K, there's a question for you. Go ahead, Delegate.
Lastly, thank you from the department, providing guidance throughout this process. Is it your understanding, and is the department okay with making certain the executive director has the authority that they need within the parameters to address some of these issues immediately with the assistance of the department, if need be? Because sometimes departments had a hands-off approach.
Yeah, no, that's why I want the this to be an emergency legislation, so that we can, Mr. Sheener has that set of recommendations, right? And so we've already begun conversations with the executive director about this. So our intention is to work through those issues, and help support the board in putting those into place.
Thank you. Thank you, Madam Chair.
You're welcome. Thank you. Anyone else? Delegate Olson?
Thank you, Madam Chair. A question and then a comment. Mr. Malloy, was there anything else that we needed to clarify or look at in the bill as amended that hasn't already been mentioned?
I did submit a written amended statement, and Chairman Pelnick was kind of uploaded to the bill file. There were several other issues. I think I was unclear exactly whether the executive director could charge or instruct the liaison to prepare charges, or should that have meant the liaison should instruct the prosecutor to prepare charges? That was one of the amendments that I saw from Monday night. I haven't read the latest set of amendments. I don't know if that's still in there or not. There was the issue of clarifying the violation and the deficiencies. One moment, I'm sorry. Let me see what else I had in my statement here.
So in the reprint page, at the top, page 10 of 11, if you look at, what is it, B?
I don't know if
Oh, I don't know if you're going to have it, but it is in here. It says the executive director may direct the liaison to prepare charges if the executive director determines that a complaint that has been referred for prosecution under Section 8 of this section alleges facts that, if true, would pose an imminent threat to human safety or other exigent circumstances exist. So it's there.
Yes, but my understanding, maybe Ms. Artie could clarify for me, is that the liaison is a board representative. And I'm not clear if the liaison can prepare charges. I think they mean the executive director should instruct the prosecutor to prepare charges if this circumstances exist.
You want to go ahead? It was supposed, go ahead.
So the way I understood this, the intent was to have the liaison be preparing the charges because of these, because of the urgency of these, in these two circumstances, as opposed to having the prosecutor do it. So generally speaking, the prosecutor is the one preparing the charges, but I understood that that might take longer sometimes, and so the purpose of this was to have the liaison do it.
But is the liaison with the Attorney General's office or the liaison a board designee?
It's, as I understand it, and this might be a question for subcommittee tomorrow when the board is available to answer questions, but as I understand it, the liaison is the Assistant Attorney General that is assigned to work with the board.
Okay.
As opposed
Well, then
to an
that would make sense
unaffiliated.
then. Okay, I thought it was
Because the boards get an AG.
Right,
assigned
correct.
to them. Yeah, and it's going to go to subcommittee, so we will work it tomorrow. Delegate Hutchinson. Thank you.
Thank you, Madam Chair. Really, my question is for you in that the floor system had the original bill in it, and so I think during our hearings, the reprint went out. So that reprint, is that what we talked about from the points with the attorney that met with the Attorney General? So we have a lot of work to do in subcommittee tomorrow. Yes, sounds like. All right.
You
Thank
do. So eat your Wheaties. Because you will. Absolutely.
As a matter of order, I'm sorry, is the public allowed to participate in the subcommittee discussion or no?
You can come.
Okay.
Yeah, we'll send you, it's up to me, and I'm saying you can come.
Thank you.
Okay? And we'll make sure that you get the link.
Thank you very much.
Okay? As well. I think, any other questions?
And I remember the former executive director,
I can't hear.
I know the former executive director.
You were
I didn't know if she had anything else to add. So.
Yeah, she can come tomorrow to the subcommittee, okay? So you can come tomorrow to the subcommittee, all right? And it's over Zoom, so it's virtual. You don't have to come here in person. And we'll make sure that you get, if we have your information, that we send you the link, okay? If there's a problem, you call our office and let them know I authorize it, okay? Any other questions? I want to take a minute to thank yes, Delegate Austin.
Thank you, ma'am. Thank you, Madam Chair. I just wanted to correct a record from the other day when Mr. Marsh was here. We had a very interesting exchange, and afterwards I learned that, one, he is African-American. You really can't see from back here very well, but even if I could, I'm not sure I would have known. We have issues in our race, and we have a whole diaspora. So if my comments were offensive, I apologize. And two, I also learned that his company has been around since 1945, so. 1957. So they have been around since the time period that I referenced as a Black-owned business, even though his grandfather had to go out of state to get the license because he wasn't allowed to get it here. And I wanted to correct the record because I thought it was important to do that based on our exchange the other day about the same topic. So thank you for giving me the opportunity.
Thank you so much. That's really beautiful. I appreciate that. That's really very kind. I want to thank you, the witnesses. Thank you both for coming out of your, you spend look at the time. It is 9:26. Thank you so much for being with us. We really appreciate you, and I'll be in subcommittee tomorrow. And Delegate Bandari, thank you for your leadership and your passion, okay? I appreciate it. And for the subcommittee, thank you so much for the work. And Delegate Semple Hughes, you're welcome here anytime, okay? Absolutely, right on. All right, so this actually, and Dr. K, thank you. This actually concludes the bill hearing on House Bill 1555, and we're going to the last bill of the evening. House Bill 1544, Delegate Bandari, Public Safety, Maryland Law Enforcement, Public Service, Medal and Key Bridge Collapse Victim Memorial Tribute.
Madam Chair, Madam Vice Chair, and member of this wonderful committee, and I promise this is number 347 and the last bill. For the record, Delegate Bandari testifying on this bill 1544, Public Safety, Maryland Law Enforcement, Public Service Medal and Key Bridge Collapse Victim Memorial Tribute. The tragic collapse of Francis Scott Key Bridge on March 26, 2024 took 6 hardworking lives and tested the strength of our state emergency response team. Before I begin, I invite everyone to honor remembering them as Delegate Taveras read the names of the 6 workers.
Dorlian Ronial Castillo Cabrera, Carlos Daniel Hernández Estrella, Alejandro Hernández Fuentes, Miguel Ángel Luna González, José Minor López, and Minor Yacir Suazo Sandoval.
Thank you. In an instant tragedy, stuck claiming the lives of 6 dedicated workers. We're laboring through the night to ensure our safety, and we were all sleeping. There were parents, siblings, and friends, people with dreams and aspiration, whose lives were cut short in service to others, who tragically lost their life, and the officers, Sergeant Paul Pastrod, Corporal Jeremy Herbert, Senior Officer William Kinsey, Officer Timothy Balwich, and Officer Gary Kurtz, who bravely saved so many others. In that crisis, law enforcement officers displayed extraordinary bravery, risking their safety to protect others. Their swift actions prevented further loss and embodied the highest dedication to public service. That night, the breeze, one so many of us have crossed countless times, became more than just a structure. It symbolized connections, resilience, and community we share. The inspiration of this bill emerged during a profoundly moving moment at Casa, Baltimore, the first event after the tragic bridge collapse. There, Madam Chair, Peña Melnick, many legislators, and I stood alongside grieving families. Each helmet on display was a powerful symbol of a life lost, a sacrifice made, and the weight of our collective responsibility. Later, during Governor Westmore's State of State address this session, we honored these heroes with a long and heartfelt ovation. As they stood on the balcony, their presence was a poignant reminder of the courage and dedication they embodied. These moments have reinforced our commitment to ensuring their sacrifices are never forgotten and that meaningful action follows their bravery. HB 1544 seeks to establish the Maryland Law Enforcement Public Service Medal, the highest state honor for law enforcement officers with extraordinary valor and selflessness. This medal will be awarded to those who have risked and sacrificed their lives to save others, prevent significant crimes, or respond to critical emergencies. By creating a formal nomination, selection, and awarding process, we ensure that those who embody the highest ideals of public service receive the recognition they deserve. This legislation also ensures that we never forget the 6 workers who lost their lives in the Key Bridge collapse. HB 1544 mandates an annual tribute recognizing law enforcement officers' heroism and the victims' sacrifices. This annual ceremony will be a reminder of their contribution, ensuring that their memory endures for a generation. This marks the 447th session of the Maryland General Assembly, which has served since 1635. While life is fleeting, we don't know whether we wake up tomorrow or not. Millions of them that die and sleep. Our commitment to honoring these heroes ensure their courage and sacrifice will be remembered for generations. And the bill initially proposed one grade promotion, but based on stakeholder feedback, I'm modifying it to a 1 pay grade level increase with language may to better align with existing structure. Additionally, the bill now includes another officer as well, Senior Officer William Kinsey, who was missing in the original bill. Furthermore, the bill provides the one pay grade increase in Maryland Law Enforcement Public Service Medal, and the Maryland Chief of Police Association, MCPA, and the Maryland Sheriff Association, MSA, support this bill with the proposed amendment. And at the end, this bill is not just about honoring those we lost. It serves as a beacon of hope and inspiration for all workers and public servants. It is tribute to those who dedicate their lives to service, compassion, and protecting the vulnerable as we rebuild our bridge and infrastructure. Let this bill stand as a symbol of a gratitude, a reassurance that their sacrifices were not in vain. I urge favorable report on HB 1544 because this is the right thing to do. And thank you.
Okay. And thank you again for your passion and for honoring these, these men and their families. Are there any questions? Delegate Hill.
Delegate Vanzari, thank you for the bill. I want to put on the record, because we honored several people on the floor, and I want to know if you're open to an amendment. I haven't crafted it yet. The people we've yet to honor are the pilots. It was a pilot who was leading the ship through, who reported the outage, who turned the ship so that it didn't hit the way, more straight. It was the pilot who notified the police so they could clear the bridge. And we've yet to acknowledge the pilots. Are you open to an amendment acknowledging the
Absolutely,
pilots?
yes.
Thank you.
All right. Any other questions? All right, seeing none, thank you so much. This actually concludes the bill hearing on House Bill 1544. Thank you. Everyone, can you bring us down, please? Thank you. Let me just quickly go through the schedule for tomorrow.